My name is Ron Hansen. I'm a physician at OrthoCure Clinic. This is a clinic that I started 4 years ago, dedicated only to healing and regenerating the human body. Mostly musculoskeletal and neurologic conditions are what we're focusing on here, but we have a full body approach to a patient, a holistic approach, where we are taking into account diet, supplements, hormones, sleep, mind-body connection, physical therapy, chiropractic, all parts of a person that need to be integrated into one for a person to live up to what my slogan is for my clinic, which is healing your body, living your best. To that end, we've worked with large numbers of other practitioners in the Twin Cities metropolitan area to bring together those who are very personalized, have a great amount of experience, and have the ability to work very personally and individually with people from their own perspective to heal combined in an integrative approach. That group is becoming a formal group and called Regenerative Masters. A lot of what I do will be doing work through that group in the future through what we call Centers of Excellence. But at the OrthoCure Clinic, all of what I've done has been created over the last 11 years of experience using regenerative agents. I'll talk about that in a separate segment. Regenerative agent experience. I started doing regenerative injections in 2007 before it was really known to most of the rest of the world. A doctor at Stanford came out with the first procedure using regenerative agents for tennis elbow, a big group of tendons on the outside of the elbow that's real common to be painful and injured in highly active individuals in sports and in other venues of life. That was platelet-rich plasma, a very early version of what we now use in very refined versions that showed near complete healing of tendons that usually would have needed surgery previously. I began using just straight blood from patients and injecting the blood into tissues that were degenerative or injured. The thought being, hey, when we get injured, we bleed, and blood has healing agents in it that come and call other agents to heal the body. We've become very refined over the years to use many different versions of blood-based healing, using platelets, growth factors, certain types of white blood cells, avoiding other types of white blood cells. We've learned to take red blood cells out. There's a protein called alpha-2 macroglobulin that we concentrate, and now the process in my laboratory is a 5-step process that takes about an hour and a half to make. That's platelet-rich plasma. The procedural changes that have happened over that same period of time, this is my 11th version of platelet-rich plasma, the procedural changes that have happened have now been applied to 40 different conditions. In that period of time, I've also created the first group around the country that's working in a combined fashion. While I was the director of that program in Colorado, there were 35 clinics, and between the conferences that I created and the national and international clinics that I created, about 400 physicians that I've trained in my 11 years of doing regenerative orthopedic medicine. That puts me in a class of about a dozen people around the country that have that level of experience. I went on to create the first fellowship in the country, focusing on only orthopedic regenerative medicine in 2010 to 11, and 7 international clinics that I've spearheaded. The 40 conditions that I've spearheaded new interventions for range from very simple things like tennis elbow to Achilles tendon, rotator cuff, arthritis throughout the body, throughout the spine, to very elegant and difficult neurologic conditions, both peripheral nerves and for the brain. This is an emerging field that I'm very thankful and grateful to have the opportunity to have worked with dozens, hundreds of individuals nationally, collaborating to create new solutions for patients with very minimally invasive care through highly guided, carefully guided procedures through arthroscopy, fluoroscopy, and ultrasound. We'll talk about that a little bit later, but from a general introduction standpoint, The level of experience that exists at OrthoCure Clinic because of my 11 years of care of patients is unparalleled throughout the country. And I'm proud to be able to bring that to people in a place that is centered around them, their personalized healing, and not around what the general medical community thinks should be done to a person, because here we're here to heal people